Hello everybody, Andrew Hutchings here, still not a licensed physician, still never giving medical advice. And I remember when I was younger that there was this, the TV claimed that there was a craze in Russia with use of a drug called crocodile. And it talked about, it must have been like over 10 years ago now. So it claimed that like people would be injecting this drug and then they lose their whole arm or they lose their leg. And some people at the time like thought, oh, that drug, like why would people inject it? Like they inject this drug, it makes you lose their arm. Then some of the TV or internet things explained like, oh, it's not actually the drug, but because they miss their veins and it goes into the muscle. And when drugs go into muscle, they eat up the muscle and get infected, and then you gotta cut off the arm. Now that is partly true and partly incorrect. So the thing is, your blood may come as a shocker to you, maybe not. Carries blood cells. White blood cells also. White blood cells are for your immune system. You probably already knew that. So if you have drugs in a syringe and they're not quite sterile, but you inject them into your blood vessel, you have a lot of contact with white blood cells very quickly. And your body can upregulate them, get even more, a whole immune system gets going. Good chance you'll be okay. Now you take that same syringe of the not-so-sterile drugs, and you inject it into your muscle. Well, muscle also has blood, but it has blood, but of course it's less blood than literally just injecting it directly into blood. You get a lot more contact with the blood if it's literally just in blood, versus in muscle, which lots of blood goes through. And that difference in blood contact is what leads to more infections in the muscle rather than in the blood vessel. So yeah, muscles are really full of blood, but it's still less than being completely in blood. Now, if the drug or the medication, whatever you want to call it, is completely sterile and you inject it into the muscle, it's not going to get infected. Why? Because if there are no bacteria, those bacteria that don't exist can't grow. Bacteria can only grow if they are actually there. If you got rid of the bacteria, well, they can't grow and cause an infection. That's why you should always use a micron filter. Good idea to make sure the exit end of that is sterilized. You wouldn't want to push everything through a micron filter just to have it pass through a dirty exit end and recontaminate it all. You also want to sterilize or put it into a sterile container, because it doesn't make much sense to pass through a sterile micron filter, get rid of all the bacteria and undissolved gunk, through a sterile exit part of the micron filter into a non-sterile container. So how would I go about this if I was doing it for a medication? It doesn't matter what kind of medication. So you get your medication, it's in its pure form, let's assume. Now if it's not in its pure form, because you're dissolving pills or something, well, it's the same principles. Or if you're putting other substances, it doesn't matter if it's water-based or not, but I'm going to say water-based for this example, but it doesn't matter. You find what the medication dissolves in, and you dissolve the medication into the solvent. So if the medication is water-soluble, you use water. Good idea to not just... if it's only one-time injection of the medication, regular tap water, probably fine. The amount of metals and junk you're going to get probably not going to impact your health to get a milliliter of that water into you. Now, for repeated usage, especially if it's every day for a long amount of time, hey, you probably want to get some medical saline solution. Now you may be going, what? You're going to use tap water to inject into your body? That's not sterile. That's why we have the micron filter that it goes through. Sterilizes it. Okay, so you dissolve the medication into something it dissolves in. If the medication was, let's say, in a crushed pill or in a plant extract, well, the medication is now dissolved in your solvent. Stuff that is not dissolved, you do not want it in your body. That's problems. If it doesn't dissolve in water, very problematic for your body to get rid of it. Luckily, that micron filter will prevent the passage of the undissolved particles. So you have your medication dissolved, passing through the micron filter. The micron filter holds back the bacteria, holds back the undissolved particles, while your medication goes through the micron filter. Now, if you're using a protein medication, it could have some issues. Depends on, and I should know the size of the smallest protein, but I don't know how small proteins can be. But yeah, check the size, the volume. Well, it's not necessarily volume, but check the largest dimension of it. Just check the overall shape of it to use some logic and see if you can pass. Like, say you have a micron filter with 0.2 nanometer pores. Micrometer. 0.2 micrometer pores. That's the good ones. Check your protein to see if it's going to have some part that's larger than that. Now, of course, if it's longer than that, but it's very thin, yeah, it can still get through. Now, sometimes it's going to hit it with the wrong conformation. It's going to block some of it. Yeah, not ideal, but yeah, some can get through if it's long and thin. So yeah, medication goes through the micron filter. It holds back the bacteria, holds back the undissolved gunk. Make sure the exit end is sterilized. So now your medication is by itself, and with any other things that dissolved in the water that were extremely small. And then I would get a vial, get alcohol, sterilize the top, get a sterile vial, sterilize the top of the sterile vial, open up a sterile syringe or just plain needle, maybe the needle came separate from the syringe, insert a needle into the top of the vial. Put another sterile needle onto the end of your micron filter. Put the micron filter with the needle into the vial, which has another needle. Why do you need two needles? Well, get a bottle, like this lovely bottle of Russian standard platinum grade vodka, and try to inflate it by blowing into it. Didn't work too well. Like, how come I can't get, even if I didn't want to inflate, because obviously the glass doesn't stretch, but how come I can't push more air into here? Like, no matter how hard I try, the air level is only this much. Why? Because it's full. There needs to be an exit for stuff to come out if you want to put more stuff in. When you pour water into a container, air goes out. If air could not go out, you could not pour more water in. So you put that needle into the top of the vial to create an exit hole for the air so that you can put more liquid in. So you put a sterile needle into a sterilized, sterile vial. Then you stick the needle on the end of your micron filter, all of which is sterile, into there, and you press the stuff into the vial. Then you remove everything, and now you have sterile medication inside of a sterile vial. And every time you go to use that medication, you re-sterilize the top of the vial before you put another sterile needle in there and draw some out. But guess what? Once again, if you're going to draw out, let's say, 1 milliliter, push in 1 milliliter of air before you draw out 1 milliliter of solution. Many people who aren't very intelligent will tell you, like with testosterone, oh, you can't use 31 gauge needles because the oil can't go through the needle. You know why your oil can't go through your 31 gauge needle? Because you're an idiot, not because the needle is not big enough. It's because you are an idiot. Well, I mean, I'm not saying you're an idiot because you didn't realize, but people who proclaim that the needle is too small, yeah. Sorry. Maybe you're in general not an idiot, but you didn't realize that it's not because the needle's too small, it's because you're trying to pull stuff out of a vacuum. You need to inject air before you can pull out liquid. I mean, you could inject liquid, but now you're diluting the stuff that's inside the vial. You'll have to inject something in because air does not mix with your liquid. It's a good thing to inject into the vial. So before you take out a certain amount, you inject a certain amount of air in, and then you can take out what you want to take out. And yes, a 31 gauge needle is big enough for both water and oil-based solutions. Why use a bigger needle than you need to use? And yes, a 31 gauge needle is big enough for intramuscular injections, even into your glutes. Yeah, maybe if you have a 2-inch 31 gauge needle, yeah, it might break after you put it in. But if you're not obese, or if you don't have high body fat, if you're thin, you can certainly use even a 1/2-inch 31 gauge needle in your glute. Now, some people who look very thin, it's actually because they have very low muscle mass, but they have a decent amount of fat. So for example, I am, on camera maybe it doesn't show it, but I've got a stomach right now also from gaining weight. Now, and I consider myself kind of fat right now. I gained 8 pounds in the last 2 weeks. But the matter of fact is that I am much thinner than guys who look much thinner than me, just because I've got so much more muscle. Whereas someone who has more fat, but without the muscle, they can be much more narrow, but the reality is that they have more fat. Someone who looked much thinner than me could not get a 31 gauge 1/2-inch, yeah, I think it was 1/2-inch, into his glute, because he actually had quite a bit of fat there. Whereas if I try to get a 31 gauge into my glute that's 1/2-inch, it's easy. I mean, right now, yeah, I could even use, and I have used for different medications, I think it's 5/16 of an inch, 31 gauge. For glutes, yes, you can use like this small, oh, actually I have one over here for epitalon. I think this one's actually a 30 gauge though. You see this little tiny thing? If I'm gonna inject a medication, I prefer to have the smallest needles. This is big enough for an intramuscular glute shot. For me, most of the time. Now, if I gain a bit more weight, yeah, it's not so good. And even when I'm not heavy, I do still make sure I push hard. That way the fat kind of moves to the sides, and it's not like this gets deep into the muscle. Like, I've got some fat, but still it can get into the muscle. Once in a while, I have actually done subcutaneous on accident with such, and I can feel it and see it, and I know that it didn't go into the muscle. Most of the time, even with such small syringes and with such small needles, I can do an intramuscular glute shot. alcohol for sterilizing my skin and my vial of Epitalon. I did not take Epitalon last night, and I had a really good night of sleep. Probably not connected. Gonna have to think about if I'll take it tonight. In case you're interested, Epitalon, it binds to histones. Histones are proteins that wrap up your DNA and inactivate it. As you get older, sorry, I'm also taking another special medication that I have. As you get older, your DNA gets more inactivated. Bodily dysfunctions arise because your body is not producing all of the things that it's meant to produce. Epitalon, well, it's not over there, but helps to turn back on the things that turn off as you age. And on top of that, it lengthens telomeres, which shorten each time your cells divide. Once they get too short, your cells either die or become defective. Good medication to take. I don't know if I will reap the full benefits of it at this age, because perhaps most of my DNA is still active and turned on. But I figure while I can get this medication, I want to take this medication. So yes, as long as the medication is sterile, and now you know how to prepare sterile medication, it can be injected into blood vessels, into muscle, into fat. Now, certain medications may have very irritating properties, so it's not necessarily a good idea to inject it into muscle or into fat. And into the blood vessel, you may have to dilute it if it's corrosive. Yeah, there's nothing scary about injecting medications. It's much healthier than taking them orally, and some medications are destroyed in the stomach, especially from the hydrochloric acid, or they're simply not absorbed well. Much lower burden on the liver because your liver's going to do the same amount of work regardless at the end of the day. The question is, do you want it to do X amount of work and have X amount of activity of the drug, or do you want your liver to do the same amount of work but have less activity of the drug, and then you got to take more of the drug, have more liver activity to have the amount of drug activity that you could have with lower. Maybe I didn't move my hands perfectly, but yeah. If you put in 100 milligrams of drug, the liver is going to have to enzymatically convert 100 milligrams of drug. The question is whether it does that before or after the drug is active. If you put in 100 milligrams of drug and the liver metabolizes at 50 milligrams of that before it's active, well, you actually have to take 200 milligrams to get 100 active milligrams, and your liver is going to metabolize 200 milligrams, whereas if you inject 100 milligrams, you get 100 milligrams active before your liver metabolizes it. I hope that makes sense. Your liver always has to metabolize the drug. But you can either waste the drug and make your liver metabolize it, or you can use the drug and then have your liver metabolize it. It's pointless to have your liver metabolize it without the drug being used, unless you need your liver to metabolize it to make the drug active as in a prodrug. Yeah, even a medical school professor told me how it's healthiest to take medications orally. I tried to explain this to him, but his English wasn't the best. He's telling me, no, they do more liver damage when you take them injected. It's like, no, they don't. Your liver has to do a whole lot more work when you take them orally because you got to take much larger doses. He was telling me, oh, when you inject them, you get much more into your blood. Yeah, that's a good thing. The reason you get less in your blood when you take it orally is because, well, one, you don't absorb as much, which means you need to take more to make sure you're physically absorbing the same amount you would absorb if you got it directly into you. But two, because your liver gets rid of some of it before you even get it into your systemic circulation. So yeah, you're gonna have to put more through your liver to get the same effect as a lesser amount injected. I'm gonna end it here. Please like and subscribe. Check out my other videos. Check out my Instagram, natural_true_fitness. Check out my website, andrewhutchings.org. We're gonna hire me for consultations on health, fitness, not medical advice, but it's not advice if I don't tell you to do it. It's just medical information. So you can hire me for medical information. If you got tendonitis, go on Amazon, type in a systematic guide to defeating tendonitis. Get the fastest shipping options, get rid of your tendonitis, enjoy your life again. I'm gonna enjoy some peanut M&Ms and take a shower and go to sleep.